Okay, welcome to the show. I'm your host, Dr. Joseph Coppus, and today I'm joined by my guest, Annette Verpillot. Thank you for being here today.
Thank you so much for having me. It's a pleasure. It's
Of
a pleasure
course.
meeting you as well.
Yeah, it's a pleasure to meet you. So can you tell us a little bit about what it is you do, Anne?
Yeah, so I work with a method that is a combination of peer-reviewed studies, functional neurology, and just the basic concept of biomechanics, in which that we look into addressing all of the sensory entries that can potentially have an impact on the muscular system to be able to alleviate someone with whatever chronic issues or chronic pain that they may be experiencing. In a nutshell, that really is what we do. So we really want to target and find out which part of the body is broken, or which brain body path is broken, so that we can restore proper functional movement.
Very good. So I'm always interested, what kind of led you down this path? Why are you interested in these things that you're interested in?
Yeah, that's an awesome question. Well, the truth be told is I was not able to answer a question to one of my clients in clinic, which was in regards to the pain they were experiencing. So not being able to answer the question, which was, will this pain ever go away, having seen this person several times before, following the intervention we were having. I went back to my teacher at the time and I said, why is it that this shoulder pain is always coming back? And the answer that I was given basically was to the least of my satisfaction, because basically he didn't have an answer. He just said, we really don't care as to why it's there. Just treat the joint and, do range of motion testing and see the client again in the following week. So this really was not something that I could live with. I found that it was a very incomplete answer, but most importantly, it led me to be speechless in a professional situation where I was not able to give answers to my client, and I'm being paid for this. So, one thing led to another. I started, a simple Google search as how do muscles contract on Google will very quickly lead you to the brain. And then I basically associated myself with different doctors, orthopedic surgeons, neuroscientists, scientists, to try to understand really how it is that we're able to walk and stand upright, and what are really the true components that interact in those different types of systems.
Okay, very good. And so you are an advocate and you practice the Posturepro method. Tell us a little bit about that approach and how you use that in your clinic with your clients.
So the first thing that we start with in regards to most conventional therapies is looking at someone's weight-bearing surfaces. And by that, I mean, how is it that you're really standing on your feet? What are the postural habits that you've developed from the early stages of your life? And how can we potentially uncoil that fascial adaptation that you've been living with for X amount of months or X amount of years? So it really does consist, a lot of the testing, most of the testing that we do is on force plate testing, because I like to be able to quantify what has the greatest impact. But we do work on other sensory entries, so the feet being one of them. And when I say the foot is really figuring out what type of adaptive foot that you've developed over time. Then, of course, we're going to include how are your eyes tracking the environment. The inner ear for us really is something that we look at the last part of our protocol. But before that, we'll look at the way at the jaw, the temporalmandibular joint. How are your teeth developing? What's going on with tongue posture? Do you have any scars? Have you had any braces? And then we're actually going to go and look into the functioning of the inner ear.
Mm-hmm. I think when most people think about posture, we were always told to have good posture as we're growing up. They probably think of it through more of a biomechanical lens, I would say would be the majority of people. But you had discussed earlier, you're looking at other things like the brain, how the brain is controlling these muscles, the inner ear, etc. Can you dive a little deeper into the different systems that really control posture?
Yeah, so in the health and fitness industry, and I think in the rehabilitation industry, excluding functional neurology, we're told to look at a problem from a local perspective. And that really is, for me, there's a chapter missing in this entire story, that we're really missing a big chunk, a big part of this important information that can give a therapist an idea of really what's going on. So, um, switching from a biomechanical approach to a neuromechanical approach to me makes much more sense, because it allows me to deliver, and I don't want to say immediate results, but when you are working with the nervous system, with someone who has a healthy nervous system, as I'm sure you've seen too in your practice, the results are really quick, right? I mean, we're talking about 119 meters per second of speed for that information to go to the brain, and then to have that muscular adjustment take place. So, working with manual therapy for a long time, 14 years ago, I said to myself, what can I possibly do to create faster results with my clients, longer lasting, right? Because I mean, if they're longer lasting, then I have to see them less. And then hopefully more permanent changes as well, which at the end of the day translate to saving time, saving money, and having more time, more leisure time to spend with your family, with your friends, and of course, just enjoying life.
Absolutely. And you wanted to get into how the feet really affect posture in the brain, right? And how we can use that as kind of a window in, and something that people may often overlook in clinical practice. Can we talk about the importance of feet biomechanics and proprioceptive input?
Absolutely. Well, in my opinion, it's not really an opinion. Science very clearly states that, the information that comes in from our feet is going to have a direct impact on our posterior chain, which, is our stability. So I think that looking at a system will always give results. But if we're not addressing, again, all of the sensory entries that are feeding into that muscular system, the therapeutic protocol, the act that we are doing in practice is always going to be incomplete. So for me, again, looking at the feet, if I'm, most people that I see in my practice are adults. I do see a lot of kids, more so lately than before. The earliest that I can work with a child will be 2 years old, and then my oldest will be 105 years old. But the point is that if we don't look at the feet, then we are missing important information. Being the foot is going to affect the mechanics of the knee. It's going to affect the mechanics of the hip, of the spine, and ultimately your entire center of gravity. So there's many studies out there that advocate the benefits of chiropractic adjustments with the realignment of the spine. So my concept is what if we can actually address these subluxations that are perhaps adaptive to a postural imbalance, and then have someone or chiro or whatever reassess the person's posture, then they would be working at that point in time, in my opinion, on primary subluxations. And we've tested this actually many times in our practice, and we've had many chiropractors actually confirm this. So the foot creates an imbalance from a biomechanical perspective. It's going to affect your posterior chain. It's going to affect your stability, right? If you don't feel right on the ground, you're going to be afraid to walk, right? You don't feel stable. And for me, it really is the missing link in most therapies out there. And as you know, when we talk about the feet, well, in North America, people tend to think about orthotics. We've created a profession to specifically address that body part, completely ignoring the fact that this specific body part affects the entire body.
Mm-hmm.
So since we're walking on our feet and we're evolved human beings and we no longer walk on our hands, for me, it just makes a lot of sense to start, for any therapist, to start looking at the feet first, and then adding whatever knowledge they have in the context of their practice.
Right. So you had mentioned the chiropractic adjustment as one powerful way to help increase proprioception from the feet. And what are some other ways that people or clinicians can address this? I know you're working on something.
Yeah, Yeah, I love it. So we've what we work with to be able to reverse foot adaptation or postural adaptation is we work with what we call postural insoles. And postural insoles are basically these thin insoles, not orthotics. They don't have wedges. These thin inserts that will work in activating different sensory receptors in the skin of the foot so that we can have that impact on the posterior chain and hence realign posture as quickly as we can. So one of the projects that we're developing that we're going to be launching in this upcoming in April, which is right around the corner, is a new type of postural insole that will allow us to offer solutions to specific pathologies, not taking anything away from the conventional postural insoles that might be a little bit more expensive, but that will that are used in a specific therapeutic context to specifically reverse postural adaptations and change posture in that specific instance. So combining the two together is a great tool, in my opinion. We've done a lot of force plate testing with them. We don't have a lot of we don't have as much data with them as we do with the postural insoles. So these would be called proprioceptive insoles, and we'll be launching them on our website in the month of April.
Very good.
And on social media everywhere.
Yeah. So by the time this podcast is released, they should be out and ready and available
Out
to
and
the
about.
public.
Indeed.
Awesome.
Indeed.
Awesome. So we've addressed the feet. I want to get into maybe how posture is affected by eye movements too. I know you've worked with that. There's a great TED talk that you did. If no one's seen it, you should check it out. But it was very, very well demonstrated where you basically did a few eye movement exercises with a woman and you helped her posture. So can you dive into that a little bit?
Yeah, so I when we think or talk about the eyes, we're not accustomed to thinking that. I mean, the first thing that comes to mind is glasses or contact lenses. I think that most of the population is unaware really of the impact of the eyes. As you know, we move our eyes over 100,000 times a day, and the idea behind that is if the muscle tension in the left eye and the right eye is not the same when we're trying to look at a specific target, whether it be from a further distance or a closer distance, the eyeball needs to move in a certain way, and that movement needs to be the same from the left side and the right side so that the brain can make sense of the image that is going into the brain, and then of course superimposing this image to have an appreciation of perception. So what I demonstrated in my TED talk was, it was basically we picked a lady out of the audience and we asked her if to just come up and see if there was a discrepancy with her eye tracking, which is called the convergence test. And what some of the correlations that we've made in our clinic is very often when someone has pain, they always have an imbalance with their sensory receptors, which is either the eyes or the feet or the jaw. And this was what I was trying to demonstrate live on stage. And I just want to specify that this was not actually staged. It's really somebody that we picked randomly out of the audience. So, I think that doing daily eye exercises, 30 seconds, like I demonstrate on the TED Talk, can help anyone really and we know that the eyes, I mean, the functional neurology group knows how much the eyes affects pretty much every part of the brain. You know that as well. So I think that just working out the eyes is a great way to get in shape, to wake up your brain, to get in shape, to activate your posterior chain, to have better stability. And in my opinion, when we address that in conjunction with the feet, then we have a double impact of stability, which translates to energy expenditure and just having more energy for ourselves to be able to recuperate and heal.
Absolutely. So by addressing both things, like you said, you're really going to have a much more profound effect on someone's, posture and overall neurological health, which could help prevent injury and, what have you down the road. So that's very good. You've mentioned the temporalmandibular joint a couple times. Why is this important in posture?
Well, because I mean, this is what the Posturepro method is all about. We don't want to neglect any body part. You know, in the 21st century, we've cut the body into different types of pieces, and we've created different types of professions.
Mhm.
I understand that, you know, that creating jobs is important, but none of these professions speak to one another. And I'm generalizing here. I'm not saying that this is the case with everyone, but conventionally they don't. You know, we have the foot specialist, the eye specialist, the dentist, the chiropractor, the physio, and, you know, and everybody's kind of doing their thing. The temporal mandibular joint, which is the lower part of your jaw, it is obviously attached to your cranium. And if it does not develop properly in the early stages of life, when you learn how to suck and when you learn how to swallow and when you learn how to speak, then it can have a profound impact on your overall stability, simply because we know, you know, whatever position your head is in is going to affect your shoulder position. That's going to affect your center of gravity. That's just one aspect of it. And there are many other links to be made with the actual trigeminal nerve, which is the cranial nerve that innervates your entire face, and other nuclei in the brain that could potentially affect our stability as well. So for me, this is a segment that is not very often looked at by therapists, because we feel that the minute that we speak about the jaw, we need to refer to a dentist. But the truth of the matter is that missing teeth, crooked teeth, narrow jaws, mandibular position that's either too forward or too far back will affect your head posture. That will in turn affect your upper back posture. That will in turn affect your feet.
Mhm.
So again, it's all about, you know, making these links and creating these loops and solidifying, finding out what's causing what, and at the end of the day, working on all of those entries at once to have the most profound impact.
Absolutely. And you've kind of alluded to this, but there's a lot of different professions that are geared just towards one of these three parts of the whole picture, or one of these parts of the whole picture. How does somebody find a practitioner, or where would somebody find a practitioner that would really look at the whole system like this?
So yeah, so we have a tab on our website, posturepro.co, where you can find a practitioner near you. Keep in mind that this map is still being updated daily. We are trying to put everybody there as quickly as we can. And if not, you know, you can always send us an email and see how, if there's someone in your neck of the woods, if you don't find them on the map. And if not, we do, you know, my passion is really the reason, my passion is to be able to educate as many people as possible, because I do believe that change will come with education. And as you know, with functional neurology, and as advanced as you guys are at, you know, at this point in time, this is still fairly unknown in the realm of rehabilitation and health. So we offer seminars. We presently, our crowd is mostly personal trainers and fitness enthusiasts, but we do work also with functional neurology doctor. We did a seminar recently with Dr. Malilo where we were able to test all of these concepts together. It was really an awesome experience.
Mm-hmm.
And the goal is to be able to teach this, which, you know, again, all of these seminars are listed, the dates are listed on my website, and if not, certainly to be able to find a practitioner near you for anyone that might need this type of service.
Awesome. Thank you. So we are just about out of time, but I wanted to make sure that we budgeted enough time at the end where you can give us any final thoughts that we may have forgotten to touch on throughout the show.
Well, I'd say, you know, if you have pain, this is for the auditors, if you have any type of pain and you've seen more than one therapist and you still have pain today, I'd say that chances are that maybe you might be suffering from a postural imbalance, and something that could be easily resolved with simply looking at a technique which is more of a brain-based approach rather than a biomechanical approach. I give a lot of tips on my YouTube channel, on my Instagram channel, where people can do simple things like simple eye exercises, or even foot stimulation, or even changing, you know, your tongue posture. And everybody that I speak to and all the messages that we receive, people are being alleviated from the symptoms that they're feeling by doing these very simple things. So if anything, at the very least, give it a try. Go check us out on Instagram or on YouTube and see if that works for you. And if you feel that this science is knowledgeable enough to be shared, then please do share it with your loved ones.
Very good. And then just to wrap everything up, where are all the places that people can find you? What are those Instagram accounts and some of the other things that we've talked about today?
Yeah, so our website is posturepro.co, and you can find us anywhere with the @posturepro on Instagram or Facebook. Twitter will be, Posturepro will be in 2 words, and on YouTube it's again @posturepro. So we're pretty easy to find on the social media channels.
Very good. Well, I want to thank you for coming on today and sharing your expertise. I thought this was a very, very informative podcast. So thank you.
Thank you so much. It was a
Of course.
pleasure.
Yeah. So from your host at the Neuro Wellness Podcast, Dr. Joe, be well.